Distinctions of the Burkitt lymphoma, which you have to understand for your examination purposes, is first of all, it shows on morphology that starry sky appearance. It is associated with Epstein-Barr virus, and CMYC translocation will occur in the Burkitt lymphoma. So, starry sky appearance on the microscopy and Epstein-Barr virus association and CMYC translocation are the key distinction of the Burkitt lymphoma. It's usually endemic, it is found in endemic form as well as in sporadic form. Endemic form is usually found in African region, and it's commonly presenting as a mass in the mandible. And sporadic form usually occurs as a mass in the abdominal region. Both are common in children, like endemic form is also common in children as well as sporadic form is also common in children, but appearance of that lymphoma, for example, endemic form is usually commonly presenting as a mass in the mandible. However, the sporadic form usually occurs as a mass in the abdominal region like ileocecum or peritoneum. So the association of Burkitt lymphoma with Epstein-Barr viruses is important, and nearly all endemic tumors are associated with latent infection of Epstein-Barr virus, and it usually expresses that CD21, which is Epstein-Barr virus receptor, through which Epstein-Barr virus is associated with Burkitt lymphoma. Then the CMYC translocation. CMYC is a growth promoter and activates transcription. So again, there will be that translocation on that 14th chromosome, IgG heavy chain, and CMYC will go and will overexpress along with IgG heavy chain, and hence growth, promotion, and transcription will occur, and cell will keep on growing without stoppage. Now, a word about T cell leukemias and lymphoma. T cell leukemia or lymphoma are usually CD4 positive T cell malignancy, and it occurs with HTLV1 infection. HTLV1, if we recall from our microbiology lessons, that it's usually associated with an RNA virus. It's a RNA virus, and it infects CD4 positive T cells. So the key diagnostic tests for T cell leukemia or lymphoma are anti-HTLV1 antibodies. So HTLV1 is an RNA virus, and it infects CD4 positive T cells, and hence can give rise to T cell leukemia or lymphomas. So the classical scenario will be that a patient is from Japan, Caribbean area, West Africa, which are all endemic region for this T cell leukemia or lymphoma. Lymphocytosis is expected, lymphadenopathy is expected, and skin lesions like ulcer, nodules, and papular rash. And then it's rapidly progressive symptoms, and usually it gets fatal in few months. So it is also showing the pattern of the lytic bone lesion, and increase in calcium and hypercalcemia will occur. So we have to differentiate multiple myeloma versus T cell leukemia or lymphoma, in which both of these disorders are presenting with lytic bone lesions or increase in serum calcium. But usually, lymphocytosis, lymphadenopathy, and skin lesions are usually not found in multiple myeloma, as well as the area of presentation of multiple myeloma is also not Japan, Caribbean, and West Africa. So in that way, we have to keep these sort of differentials in our mind when we see the lytic lesion of the bones. Then the cutaneous T cell lymphoma. It's a skin disorders of malignant T cells, and it's also showing that variable expression of CD markers. It presents with skin lesions. So the localized disease, cutaneous T cell lymphoma, if it is showing as a localized disease, it is called mycosis fungoides. And if it shows that diffuse systemic disease, we will call it Sézary syndrome. So mycosis fungoides presents as patches, plaques, or tumors varying size and shape. Lesions progress slowly, changing shape, size, and appearance, slowly developing, and classically in a bathing trunk distribution. So we will diagnose it via skin biopsy, which shows the lymphoid cells in the upper epidermis, and the epidermal aggregates are also found, which are also known as portreal microabscesses. So mycosis fungoides, as we have said, it's a localized disease with the presence of epidermal aggregates. However, the Sézary syndrome is a systemic disease. So T cell lymphoma affecting skin of the entire body, and there is a widespread spread erythema or skin reddening, lymphadenopathy, and malignant cells in the blood, which are known as Sézary cells. So Sézary cells are basically multi-lobed nucleus in the cerebriform shape. So just like a brain, cerebriform shape and multi-lobe nucleus in the Sézary cells, we will find it in the blood. So Sézary syndrome as compared to um, mycosis fungoides, Sézary syndrome is a widespread disease of the whole body and mycosis fungoides is a localized disease. Both are cutaneous T-cell lymphomas. And this concludes our podcast about non-Hodgkin lymphoma.